Alrighty. Good afternoon, everyone. Thank you all for coming. We are recording our presentation today, and we are planning on posting this also at our website, so for future reference for everyone. I'm Dr. Claire Lazaro. I'm the Clinical Director at VMRC. As you all know or have heard, CalAim has a program wherein the ICFs as part of the long-term care providers will be carved in into a managed care plan, and Health Plan of San Joaquin is very generous enough to give us a training and in-service on that and give us more information about that and the latest news as well. So I am giving now the floor to Ms. Helen Bayarian.
Thank you, Claire. Welcome, everyone. If we could go to the next slide. I think so that we know who's here and who we can send information to, please put your name and company name and best contact information in the chat so that we can then email or mail information to you. Okay, my name is Helen Bayarian. I'm the Director of Contracting here at Health Plan of San Joaquin. And as Claire mentioned, we're implementing Carve-In for long-term care. That has actually already happened. It was effective the first of the year. So all the long-term care facility services and claims payment has been managed care, and one of the two managed care companies for San Joaquin and Stanislaus is responsible for those members. So all members are now part of the health of one of those two health plans. Okay, so under CalAim, managed care will cover and coordinate medical institutional long-term care services for all counties in 2023. This is a phased-in approach. So as I mentioned, beginning of the year, long-term care residents with access were carved into managed care. And this gives long-term residents access to coordinated and integrated care within the Medi-Cal managed care and make coverage consistent throughout California. So prior to 2023, some counties were responsible for long-term care and others were not, but now the whole state has been, all long-term care has been carved into managed care throughout the state. As I mentioned, long-term care has been carved in, and then effective January 1st, 2024, ICF and ICFDD facilities will also be carved into managed care. That date was just pushed back last week. Previously, it was July 1st, 2023, but because there's so much work to be done, and this is so brand new for these facilities, DHCS agreed to push back the date to January 1st, 2024. Okay, so we're here to introduce ourselves as well as mention and try and walk you through a high-level review of the contracting process. In order to receive reimbursement, we would want you to be contracted with Health Plan of San Joaquin, and that involves several steps. So we have a provider application, which is fairly basic, that we would like to send to you, and that's why we need your contact information. And you would have to be Medi-Cal enrolled, which I'm sure you are. The forms would be returned to us. We would go through a check of the Office of Inspector General as part of our process. And then there's a credentialing review, and we have Andrea here who will walk you through some of that credentialing piece. That's where we request certain documents from each facility And once that is approved, then we can send you the contract for execution. The turnaround for credentialing is typically around 30 days if we have all the documents. And then once the contract is executed, we have assigned provider services representatives who will be able to reach out to you for new provider orientation. That is mandatory per DHCS. So I think we have a representative here from provider services as well, who can give you a brief overview of what they do. But first and foremost, even though the start date has been pushed back to 2024, we'd like to get a head start on the credentialing and contracting so that we're not in a mad rush for that date, because DHCS does request that we have a network in place probably 3 months before the start date. So by September, we're expected to have all the facilities contracted with us, they're trained, etc., so that we're all ready to begin providing services to these members the 1st of 2024. So we don't want to wait and create any further delay. We'd really like to start at least the credentialing process as soon as possible. We have the next slide, please, Claire. So what we're also doing in the organization is we're coming up with frequently asked questions. And most of you probably have questions about, well, how do I request an authorization? Is there a TAR needed? How long does it take? Will all my patients be authorized? So that will be part of the frequently asked questions that we're developing right now. We'd like to hear from you as far as what questions you want answered. We kind of have an idea of the questions you may have, but if you have particular questions that you need answered, please let us know, and we can add that to the frequently asked questions for this to provide a comprehensive response. We'll also be providing billing guidance. That's another concern, I'm sure, of your facility is, how do I get paid? What do I need to do to submit claims? We'd be interested to know what you do today to submit claims so that we can answer your questions in relation to how you process these claims today. And then we'll have many more communications coming out from Health Plan of San Joaquin. There'll be provider alerts and other emails that you will receive from us. We'll try to make it as informative as possible so you can get all your questions answered. Thank you. Okay. Andrea, are you there?
I am here. I apologize. My video does not like to work on Zoom, so sorry about that. But hi, my name is Andrea Swan. I'm the director of QI, and I'm over credentialing as well. So it's great to see everyone and meet everyone today. I'm just going to give you a really high-level overview, like Helen said, of our credentialing application, and I can actually send a copy of that over to you as well, and then just walk you through the steps. And so we can go through the next slide. So for credentialing, and this is so that the provider or the group is actually credentialed with our plan, which is one step in the process. We need to have proof of the Medi-Cal fee-for-service enrollment. So, you know, I know you're familiar with this. You can just print a copy off. We can just take, you know, any screenshot that you have. And as long as we have proof of that, then that's fine. Also, the ancillary application, which is what I'm going to send over to you, we need a copy of that. And really, that application is really basic. It asks for your name, your address, if you had a site review, because I know some facilities have site reviews. So you would have to just give us the date of that. We would ask for your state license information to be put on that application. And then there's a bunch of stuff that won't apply. So what I'll do is I'll kind of highlight everything that applies to you as well. And then we need a valid copy of the facility license. So my understanding is that there's a state license that you would have. So we would just need to have a copy of that. And then also your malpractice certificate. So we would need to have that as well. So as long as, and it just needs to state your facility information on there and then what your limits of liability are. And then if you're accredited, which I know some facilities are not, if you are, we would just need a copy of that. And accreditation could be different depending on the facility. And then finally, a copy of your W-9. We would just need a copy of that. We put all that together, we verify everything, and like Helen said, it takes us about 30 days to get everything verified, and then we can actually move forward with the credentialing piece for you. Also, I put on this slide, I'll also be sending you the email, but we have our lead credentialing specialist. Her name is May Cayetano, and I put her phone number in here so that when you're going through this process, if you have any questions or concerns, you can reach out to her directly. And that's everything for me. Thank you.
Hello, my name is Christina Viad. I'm a provider service representative. I'm going to see if my camera will cooperate. See. Whoa, okay, there I am. Next slide, please. So in provider services, once your contract, all of the stuff is executed and completed, provider service will schedule an in-service with you to do a complete onboarding. But some of the things we're going to go through is we're going to show you how to verify members' eligibility. There are 3 ways to verify eligibility online through our provider portal, which we will give you access to our secure portal. You could check eligibility for our members as well as claim statuses. You can call our customer service number Monday through Friday from 8 to 5. And we also have an interactive voice response, which is available every day, 24/7. And you would just enter the member's Medi-Cal ID number or Social Security, and then it will give you the eligibility for the patient. Next slide, please. Another thing we'll go over is the authorization process and how authorizations can be submitted to Health Plan of San Joaquin. There's two ways. Again, is our online portal. You can do everything electronic through our DRE portal, which is fast and secure. You can also download and print out an authorization form, and you can fax it in. So San Joaquin and San Jose County, 2 different fax numbers, but you can also fax those in if you don't have access to the portal. And then turnaround times for authorizations. A routine request would be 5 working days of receipt from receipt date of the authorization request. And then urgent is within 72 hours of the receipt date from the authorizations. During the onboard training, we will show you how to search payable codes to identify the services you are providing are reimbursable. So we will go over all that with you when we do the onboarding and the authorization kind of walkthrough. Next slide, please. Another thing that's really important is claim information, the requirements. So all claims must be submitted to HPSJ on a CMS 1500 form or a UB04 form. That's the paper forms, or you can submit it electronically. We currently have 2 vendors where you can sign up and submit electronic claims. So Change Healthcare formerly known as MDON, is one of our vendors for electronic claims and payment. I have left their number and also their link. And then we have Office Ally. That is our payer ID. And you just can call them and you can set up an account and you'll be able to do electronic billing and get your remittance advice of all your payments. So we will go over that in more detail when we do your onboarding. And next slide. This is how you get in contact with us. Like Helen stated, Amanda is on the call. Amanda and Myra are our contracting contacts. Here are their emails, as well as my name and my email. Reach out to us with any questions. And if for any reason you can't get a hold of us, please call us at our customer service number listed below. Thank you.
Thank you so much, everyone, for attending. I know this was really short and sweet, but it was mainly to introduce ourselves and to get things started. Of course, you probably have questions. If anyone has questions right now that they'd like to put in the chat box, or if you can take yourself off speaker, we'll try to answer your questions. Or at any time in the next few days or weeks, if you determine that you need an answer for a question, please email the contact people that were on this presentation. Thank you.
Is there any questions right now from the group? Feel free to unmute.
Hi, good afternoon. I do have a question. I have a consumer who we're looking into relocating to an ICF home. Right now, he has a different managed plan. So my question is, if we were to switch him to Health Plan of San Joaquin, how soon can we start exploring funding for the ICF with Health Plan of San Joaquin? Not sure what the process will be after we switch his plan for him to be eligible to receive services and payment for his ICF.
Well, Health Plan of San Joaquin, as well as HealthNet, who's the other Medi-Cal plan, and these counties will not be responsible until 2024 for payment of ICF services. This is just a preliminary meeting to get the credentialing and contracting in place, because that does require a pretty long lead time. I'm not quite sure about your member, and well, currently probably fee-for-service Medi-Cal reimburses for these services, and that would continue into 2024.
Thank you.
You're welcome.
We have a question in the chat from Tina. What is your anticipated turnaround time for payment from time of claim submittal?
Christina, do you want to take that?
Yeah, so claim turnaround time is 30 to 45 days from the time we get it.
Thank you, Christina.
Thank you.
Another question here is, would you be willing to contract with Therap for electronic billing?
So if the electronic vendor, a lot of times there's other electronic billing companies, vendors, you would want to check with them to see if they use a connecting service that would connect to our electronic billing. You can send an email and I can ask my my EDI team, but you would also want to check with that vendor because there are other ones that providers use.
Thank you. Any other questions from the group?
Yeah, I have sort of a follow-up question to the first one. And you may not be able to answer, maybe Claire can answer. We have a consumer who we've actually moved to an ICF in Health Plan of San Joaquin's area. She's actually from the Foothills area, so she is with Anthem Blue Cross. ICF is not covered under fee-for-service or under Anthem Blue Cross, so we were going to switch her to fee-for-service, but I think our concern might be now that we might not be able to do that with the transition to the managed care Medi-Cal. So we had a incident actually this week, last week. We were trying to get her discharged from the hospital, and we're having problems because of this transition, and so nobody could take her because of the complications. So I don't know if that question made any sense.
Is it because primary doesn't cover the benefit, her primary insurance, or is Anthem her Medi-Cal?
Anthem
insurance?
is her Medi-Cal.
It's
yeah.
her Medi-Cal?
And she does not have Medicare. So
if she's moving to San Joaquin County, right?
Mhm.
The member or the resident's family or decision maker would have to see about transferring the Medi-Cal to the current county. I don't know about out of area how that works.
but if Health Plan of San Joaquin won't cover ICF until January 1st,
Medi-Cal fee for service, so you would want to talk to the eligibility worker about possibly having her fee for service.
so we would need to do that. So
In fact, managed care doesn't cover ICF.
Yeah.
Unless you're in a different, I correct myself, there are some counties that, such as the coast, counties that do cover ICF facilities currently.
yeah, we were told they don't in this case. So my concern is that, and I don't know if you know, would they be able to decline, to refuse, or to switch her to fee for service, since they're working on this transition to managed care?
We're not sure.
Yeah, that would be a healthcare options question,
Okay,
unfortunately.
yeah, that's very confusing. Okay, thank you.
Thank you, Debbie. We have another question in the chat from Shirley. She said, right now, we send in TARs for renewal in ICFs every 2 years. In January 2024, are we going to have to redo all our TARs?
That will be answered in the FAQs that we're developing. But we'll take that question back and make sure that it's part of the FAQ response.
Thank you. And for those who need the information, Elizabeth has posted the call center phone number for HCO. So it's in the chat, so feel free to look at that and copy. So if you guys have any questions, need to contact them, you have their contact information. Any other questions from the group?
If I could remind everyone, oh, there's a question. Mhm.
Our current turnaround for payment is about 10 business days. Will you look at expediting payment?
Typically we pay sooner than the 30 to 45 days if it's a clean claim, but that is our policy and turnaround. So we don't pay one provider differently than another.
How long is it again, Helen?
It's 30 to 45 days.
Okay. And then, okay, yeah. HCO means healthcare options. Yes. Here's another question from Sarah. How can we disenroll a consumer from Health Plan of San Joaquin who lives in an ICF?
And Dr. Lazaro, I actually was just in sending a communication to Angie about that. And healthcare options is the best person to ask for that because they have their process and we certainly don't want to misguide you and give you the wrong information. That's why I had also sent that to Angie on an email as well. And I wanted to put that on here as well too.
Thank you, Elizabeth. So
You're welcome.
to answer Sarah, call healthcare options, the HCO call center department that's posted here, 1-800-430-4263.
Thank you.
You're welcome. Any other questions?
If I could ask that each of you, please put your contact name in the chat box. As we mentioned, I see that several of you did. We will take that information and we'll be sending you the credentialing information so we could get a head start on this. Thank you.
Thank you for doing that. And then before we go, I'll just share again in our screen. Here are the contact informations also for Health Plan of San Joaquin, their provider contracting department, and also their provider services department. Their email addresses are there. It's all here, and feel free to contact also their customer service if you are unable to reach any of them.
I think I saw a question about the FAQs. We're working on those now, and we will let you know as soon as they're available. We'll actually send it to everyone, so it's important that we have your contact information. Thank you.
So what I'm gonna do is, before I close this meeting later, I will copy those that are in the chat in a Word document just to make sure that we have it in case Zoom is not able to save it. We have our own copy, and I'll send it to Health Plan.
Sorry, I have a question. My name is Rosie. Sorry, I joined a little bit later. When are we going to get the rate adjustment for 2022?
That regional center, do you have any information on that, Claire? Because we don't.
Oh, is it the rate adjustment for ICFs, Sarah?
Yes. ICF DDH and ICF DDN.
I think I saw Brian here. Brian, are you still here? Is that something?
Yes, I'm here.
Or Robert? Oh, thank you.
I'm
Is that
here,
something
Claire.
you'll be able to answer, Brian?
Sure.
Let me look at that, Brian.
Okay, they're looking it up, Brian and Robert. Thank you. Thank you for assisting us on this one.
Thank you.
While they're looking it up, any other questions from the group?
Hi, Claire. This is Linda from Laguna.
Hi.
Hi. When do we start? So if it's gonna start on January 2024, when can we start submitting or for the application to switch?
You mean the application to be contracted?
Yes.
That will be very soon. In fact, in the next couple of weeks, we'll be sending out the applications to you.
Okay. Thank you.
You're welcome.
So if you haven't put in your information in the chat, please feel free so that Health Plan can send that to you. We will also reach out. I know the other big managed healthcare provider in our area is HealthNet. So we'll also reach out to them if they could do something like this as well, so that they can share their process also to our ICF providers. Do we have any other questions? Okay. Before we go, Robert, were you able to find that?
Yes, I well didn't find it because BMRC doesn't set the rates for ICFs, Medi-Cal. So it doesn't, you know, as far as our involvement with rates, there is no involvement with the regional center.
Thank you for clarifying, Robert. Thank you, Brian. Brian also put it in the chat.
Okay.
PMRC does not set the rates for ICFs. Thank you. Okay, so if there are no more questions, I will turn off the recording now, and this will be posted in our website as well. So if you know of other ICF providers that were not able to attend and would like to learn more about this, they could, of course, use the recording that we will be posting.
Well, Health Plan America is very excited to partner with the ICF and ICFDD facilities. And again, if you have any questions, please let us know. Thank you, Claire, for facilitating the meeting.
You're welcome. And thank you also to Robert, who helped me in contacting. He was the one who sent the invites to the ICF providers. So thank you so much, Robert.
No, not a problem. Thank you, everyone.
Thank you.